We have Sarah, who's our speaker today, so we'll get her more of an introduction in a little while. And we have Jason Adams visiting us. He found out about us from events that we do and stuff, and looked us up on our website. Our website's getting some action, yay. And we have Matthew visiting us again. He has an application in, so yay. Make sure you get to know Matthew because he may be becoming a member here. We are going to start a Rotary Minute. Finish chewing, no rush.
Good morning, everybody. This probably is going to be less than 60 seconds, but I did some messing around with Google yesterday on the concept of every little bit of counts. Specifics about what Rotary has done for all the flooding that's been going on in Vermont. Barry Rotary Club raised over $30,000 for the Barry Community Relief Fund in 2023. Cambridge Area Rotary Foundation donated $7,500 to the Cambridge Flood Disaster Fund. Waterbury Rotary Club distributed bag lunches to volunteers helping food cleanup. And our club, as you may recall, rallied in July of 2023. Fill cleaning buckets to assist Vermont flood victims working to make their homes livable again. Each bucket included liquid cleaning agents, gloves, masks, and cleaning tools specifically chosen to address post-flood needs. And we, and when I say we, I mean, I know Leslie, filled backpacks with school supplies for kids whose homes had been ruined by the flood in 2023. All of that is to say, when it comes to every little bit counts. There's a quote I used to have on one of my office walls in my 20s. I don't know who said it. I said, "We may not know the full consequences of our actions and words, for they often have unforeseen effects. But it is imperative that we act and speak, for inaction can be just as detrimental as a misstep."
Thank you, Ted. Always great to hear about what we're doing locally. But I see we have a few more people showing up online. There's Sarah Tischler visiting us and Jerry Bloom as a guest. And look, Howard's here from wherever he is in the world right now.
He's traveling.
Very good. Yeah, Howard's in Europe somewhere. All right, I think that's all our guests. Next, we'll have John introduce our speaker.
Hey, good morning, everyone. With me is Sarah.
John, if you want to come up and use the mic, that would be great.
Sure. Good morning, everyone. As we all know, it's been a brutal winter, and it's been especially hard on the homeless. There's been way too many deaths due to hypothermia, and Sarah's critical in this part to end homelessness. She's a special assistant to end homelessness for the City of Burlington, developing and managing homeless initiatives and policies to ensure homelessness is rare and brief in Chittenden County. Previously, Sarah was employed as the Director of Housing Retention and Services at the Burlington Housing Authority, administering innovative programs such as housing retention and Offender ReEntry Housing Programs. So, without further ado, and she lives in Charlotte right now, and Sarah Russell. Thank you, Sarah.
Thanks, everybody. It's so nice to see. I wasn't expecting so many people here, so it's really wonderful to see so many people engaged in your community. Today, so John Jacob asked me to join you all to talk about homelessness. And first, I'm going to talk a little bit about my position alliance, because that is a way that folks from the community can sort of get involved and stay up to date on what's happening related to on the ground work and policy work related to homelessness. So first, as John Jacob said, I am the Special Assistant to End Homelessness for the City of Burlington. It's a big title. And we are in a much different place than where we were as a community when my position was created in 2022. The mayor, Merle Weinberger, with the City of Burlington, wanted to make a real investment in the city's level of accountability around homelessness issues, and utilizing ARPA funds, created my position along with a 10-point plan to end homelessness by 2025. At that point, we had our numbers related to homelessness were far lower than where they are right now. So I have not ended homelessness by 2025. Unfortunately, it has only gotten worse. So I, might be failing at my job a little bit here. So the majority of my position with the city is to oversee the policies of the city and to work as the single point of accountability for the city related to around homelessness. When I started the position, it was very policy oriented and systems oriented. And in the midst of a real changing environment around homelessness, I've had to flex to doing some direct service, which is something I, as a trained social worker, have done for many years, but did not anticipate the that pivot at this point. So I also co-chair the Chittenden County Homeless Alliance, which is the local decision-making body for Chittenden County. We receive and allocate federal what's called continuum of care funding from HUD to fund rental assistance for permanent supportive housing. And permanent supportive housing serves our most vulnerable populations, so people who have a disability and people who are what we call chronically homeless. And I'm sure you hear a lot about chronic homelessness. There's a very specific HUD definition of chronic, which means that someone needs to have been homeless for 12 consecutive months or have at least 4 3-month stints of homelessness over a 3-year period of time. So the rental assistance gets allocated by the Chittenden County Homeless Alliance to our partner agencies in the area to house folks. Additionally, the Chittenden County Homeless Alliance has discussions related to our coordinated entry system, which I'll go into in just a minute. We review data monthly at our meetings to kind of measure our impact, our success, and our challenges. And we also advocate for policy change at the state level. We have it's a group of voting members. There's about 25 or so, 26 agencies who are voting members of the steering committee. We also have community members who join us from across the county. We have representatives from our faith-based community, and we also welcome and really lift up the voices of people with lived experience, because we believe that their experience accessing our system should really shape and inform policies and services that we provide to them. So at these meetings, there's actually one at 9 o'clock today. We meet the first Thursday of each month from 9 to 11. That is an in-person meeting, hoping for maybe a hybrid option at some point. And we start the meeting each time with reviewing our local data, which we gather from our coordinated entry system. A coordinated entry is you might read about this in the news and hear about it, and basically at its core, this is a HUD mandated system that we need to have in place in order to draw down those federal continuum of care dollars to our community. And coordinated entry really creates equity and access to homeless and housing related resources in our community. So prior to coordinated entry in 2015, when you were experiencing homelessness, you might go to an agency and do an intake and ask you a bunch of questions and work with a case manager, and you would have access to housing resources that that agency had. If you went to an agency that was under-resourced, you would have less resources, you have less options. If you went to an agency that had a lot of connections in the community through, philanthropy or private landlords or, whatever resources that might look like, you would have more access to homeless and housing related resources. So with coordination, it creates a no wrong door approach, which means that no matter what organization you go to for assistance, you're going to be asked the same questions. Your name is going to go on a community-wide, what we call a master list. Some communities call that a by name list. Ours, we call a master list because it's not required to have your name on that list. And for some particular subpopulations, such as folks fleeing domestic violence, we would use like a unique identifier to protect, confidentiality. So then once your name goes on this list and you're working with a case manager, we funnel resources from the community, whether that's the housing authority or an affordable housing provider such as Champlain Housing Trust, or rental assistance, from HUD. All of those resources are funneled through the Homeless Alliance, and we pull from our list based on vulnerability. So we want to this allows us to make sure that we are targeting resources to our most vulnerable community members. Typically, that looks like households that have high level of vulnerability due to medical issues, mental health, substance use, et cetera, fleeing domestic violence, and people who have experienced homelessness for the longest period of time. So we go through that list, and while we're funneling the resources in, we're pulling from the list in a coordinated way. And it doesn't matter which organization you work for, you still get access to all of the community resources. So that's in its essence, coordinated entry. It's been a real game changer for us to be able to have local data. So we pull our data on a monthly basis, and that gets reported out at our steering committee meetings once a month. I don't have the most current data with me this morning because our meeting is this morning, but I can speak to last month's data in that we in Chittenden County have our highest rate of homelessness that we've had in the last 12 months. So we have about 830 households in Chittenden County who are enrolled in coordinated entry, which is wild. We haven't seen a number like this. We've been hovering anywhere between 780 to 800 for a while now, but now seeing those numbers creep up is very concerning. We also, from that data point, break down into subpopulations. So we look at the number of families who are experiencing homelessness, families with children under the age of, under the age of 19, recognizing that you can still be 18 and be a dependent in a household and attending high school. Right now, we have our highest rate of family homelessness in Chittenden County, and that number is at 89, with 89 households with children in Chittenden County who are living in family shelters or the motel program, et cetera. We also break that number down based on veteran status. We have, memory serves me, around 17 veterans in Chittenden County who are experiencing homelessness. Further, we break that number down into transitional age youth. So that would be youth ages 18 to 24, which is a real pivotal period of time for our youth. Many of those youth are exiting foster care situations, and they're an incredibly vulnerable population for a number of reasons, mainly because when you're exiting foster care, you lack the natural supports family supports that you might have if you are not within a foster care system in most situations. Additionally, youth exiting foster care at 18 or 19 years old are not necessarily going on to higher education, which means that they're entering a workforce where the wages are extremely low. Many times they don't on our assessment have the same level of, they don't have a disability necessarily. They're just a young person who has very low income, which makes them super vulnerable. It's also to go on about vulnerability with that population, it's also a population that's very influenced by their surroundings and by their environment. And without guidance and support and positive relationships and connections, we see this population slide quickly into chronic homelessness, which you heard about the definition earlier. So long-term homelessness and long-term instability. So we look at that data. We have about, in Chittenden County, we have about 40 youth who meet that definition. So looking at that data, we also identify the number of households who are exiting homelessness. So the things that we measure related to homelessness are what we call the inflow, so people who are entering homelessness, and then we measure the outflow, so people who are exiting homelessness into permanent housing. And in Chittenden County, we have been able to consistently exit between 20 and 25 households each month into a permanent housing situation. Some of the major concerns on the horizon, I don't think I need to tell anyone here, we have some pretty significant challenges at the federal level, which are really impacting us on the local level. Some of those are related to the elimination of our fair housing programs. Fair housing, I don't need to go in depth, I'm sure most people are familiar with that, but really provides protection and accountability for landlords or housing providers to not discriminate against people. And without these fair housing programs, our local grants have been cut at this point. It opens the door for discriminatory practices related to folks entering housing or being exited from permanent housing as well. So that's a huge concern. We're also very concerned about the reduction in HUD rental assistance funds, or Section 8. Section 8 has historically been a program that has had bipartisan support at the federal level for many years. And we're seeing reductions to that budget now. I don't know if you've heard, but there's a little bit of an upheaval at some of our federal agencies. And that is causing significant challenge and stress here locally. So what that means is the Burlington Housing Authority, where we access most of our rental assistance or Section 8 vouchers from to house people in permanent housing, they're expecting about a 2.5 reduction in their annual budget allocations. That results in them they pulled back 70 vouchers for 70 families that were searching for housing out on the street. And also is meaning that they are unable to issue any more rental assistance or Section 8 vouchers for the remainder of the calendar year. So what that means is that we have no exit for people to come out of homelessness. And I'm sorry if you were hoping I would come and give, I have some high points and places of success, but I think that this contributes to a backlog. We're stuck. And it's not only, it's households who are experiencing homelessness that have no exit, but it's also the service providers that are working with them. It is absolutely demoralizing for direct service workers to know that they're going into work every single day. They're trying to support people and they're trying to motivate people. They're trying to say, come on, we can do this, and to know that there's no exit at this point. So I think it's affecting our system outflow into permanent housing. It's affecting the mental and emotional health of the households who are experiencing homelessness. And it's also deeply impacting and exacerbating our workforce challenges in social services. Because of this, it's critical that we maintain shelter capacity. And we we advocate for continuous shelter until folks are able to enter permanent housing, which is looking like a lot longer these days. Last year, the average length of homelessness, according to our data, this is just for Chittenden County, was around 250 to 340 days. So that's the average length. Certainly there are some long stayers in there, folks who, we have a lot of barriers in our system to being able to, to help them. Then there are folks who come into homelessness, enter through that inflow, and then exit through that outflow much more quickly. But our average length is, around 300. And that was for last calendar year. That was before we had these federal changes, federal funding changes that affect our rental assistance programs. When we hear about the General Assistance Emergency Housing Program, or the Hotel Motel Program, as most people call it, limiting numbers of days that folks can stay in those programs to 80 days, that doesn't align with our system at all. So folks are able to access a very temporary shelter stay through the motel program, and then they're exited back into unsheltered homelessness. We in Chittenden County do track unsheltered homelessness, and it's important to know that 840 number that I shared of households who are enrolled in coordinated entry, a large number of those folks are not enrolled in coordinated entry because they are unsheltered, because it's very difficult to connect with someone to do an assessment and enroll them in services. So we in Chittenden County just got the data report last night, have about 227 people who are living unsheltered across the county. Most of them are primarily focused in the greater Burlington area due to access to resources, and proximity to services that they might need. So that population is incredibly vulnerable, sleeping outside. We're due to changes to the motel program in the fall, and the room cap, so we bump up against that length of stay cap of 80 days. And we also bump up against a room cap that was put in place by the legislature. Because of that, we saw people with significant medical issues that were being exited from the motel program. And we have a very unwell population of people who are sleeping outside. Many of them have never camped before, so they're not able to necessarily set up a tent or establish a camp, and are largely sleeping on the ground. And I think anybody who's been to Burlington in the last few months has really kind of seen some of the changes in landscape around people being outside and having to live outside. We support our outreach teams with connecting with those folks who are outside. This winter, due to the lack of shelter capacity that we have, due to the changes in the motel program, and due to the number of people who are living outside or unsheltered, as we would say, and the number of vulnerabilities that they have, the City of Burlington has been operating in extreme cold weather shelter. This is a pop-up shelter. We've operated 5 times, and we've seen anywhere from 65 to 90 people present for shelter at the Miller Community Center. This is my pivot into direct service has been operating in this shelter. The 5 times that we've been open for 8 nights. The state's criteria for operating an extreme cold shelter is that temperatures must meet a threshold of -20. And in Burlington, we felt like that was outrageous. So we adopted a policy with a lower threshold of -10, which is still outrageous. So I stalk the weather website constantly. But because the city is not a shelter provider, we're not even a social service provider, we have to staff these shelters utilizing overtime staff from different organizations. And when we call these shelters, say that and go into sort of active status, if you will, we have about 24 to 48 hours to build a staffing roster to support up to 90 people, which is wild. So, and expensive and exhausting to direct service providers coming in to do this work. So that is not a sustainable model for us. It's really responding to an emergency crisis situation when the temperatures are so low. What is the difference, you might ask, between some being -8 or being -10? Not a whole lot. The acuity of needs that we see at these pop-up shelters is extreme. We have elderly people, we have people in wheelchairs, we have people who are incontinent coming in with their clothing frozen to their skin. We see a very unwell population of folks who are outside. And all of this is suffice to say that we need, as a community, as a county, as a state, more service-enriched shelter options for folks. And there's a lot of talk about the motel program being very expensive. I want to put that myth to bed. That it is, the state has capped the motel payments at $80 per night. There's one person in that room, it's $80. If there's 5 people in that room, it's $80. For us to provide shelter in the community, it is in the ballpark of $120 to $160 per bed night. So that's one person. There are additional resources certainly within the shelter setting. We're able to connect with folks and they're not as, kind of out there in these motel programs. But the answer is not to end the motel program. The answer is to embed services within this program to actually make it a program instead of this year to year constantly fluctuating and changing. On the state level, I guess I'll close with saying as a sort of ask for advocacy, both on behalf of the City of Burlington and on behalf of the Chittenden County Homeless Alliance, is that we are looking at the end of that seasonal motel program on April 1st. There is the Budget Adjustment Act that has been endorsed by both the Senate and House and the legislature, and that will help the households that are in the program right now to stay in the program until we have some more long-term solutions until June. If that Budget Adjustment Act is not signed by the governor, then we will see in Chittenden County 88 households lose their motel stay on April 1st. And 12 of those 88 are families with young children. We cannot have children unsheltered. We cannot have children and elderly and people with disabilities living in tents in Chittenden County on April 1st. So that's the point of advocacy, I guess I would throw out there to you all. And I think I'll stop there. It looks like I'm out of time, so thank you.
Well, 5 minutes for questions.
Oh, okay.
Anyone have any questions?
What's the bill?
It is H-141,
It's called the Budget Adjustment Act.
Budget Adjustment.
The AA,
And it has a million things in it.
Yeah, it
You
has-
have to know
yeah.
exactly what you're.
yeah,
It actually has I think there's like 3 main things that are related to housing and homelessness. Yep.
Yeah.
One of them is $1.8 million to keep the households in the program until June. Those 88 households just in Chittenden County, it's hundreds of households across the state. The other is about $8 million for affordable housing production to Vermont VHCB.
That's
Vermont,
crazy.
yeah, yeah, Conservation Board, and the remaining, I think around 2 million is for an investment in the development of affordable housing for adults with disabilities.
Not so much a question as a comment. Obviously, I'm not on the front lines as you are, but from the secondary or tertiary level, I'm a guardian in the family court system. And yeah, the news of, reduced housing, from families that I'm, associated with and working with in a program through the family treatment court. Yeah, you can't move up and get back a life without housing, without a lot of things, but the despair that I can see in families that are making progress is huge when they're told, there's nowhere to go. So, continued good luck, and we'll all try to do the best we can, but, giving people hope, if nothing else, is super important.
Are there any other countries that have a more organized system or have an answer that may be working pretty well to take care of the problem?
I'm not familiar with necessarily other countries per se, but across the country, I am aware of some that are doing better than Vermont. So I think, as you heard, Vermont has now the 4th highest rate of homelessness, according to our annual point time count. We had for, I think, 2 or 3 years in a row, the 2nd highest rate of homelessness in the country. The 4th is a little bit of a, it's misleading because at the time of the point, it's 1 day of the whole year, which is ridiculous. And at the day of the point in time count, which is, January 22nd, or that week, last year, there were huge numbers of people who were displaced and homeless due to the wildfires in Hawaii. And there was also an influx of migrants into New York City. So their rates increased, but have subsequently decreased, and the story doesn't, necessarily tell that. There are other communities that are doing better. Well, a lot of 56 other communities, to be exact, that are the states that are doing better than Vermont. And what they have that we don't is county level municipality. So one of our challenges, and something we're working on with the Homeless Alliance, is that the funding comes directly from the state and goes to nonprofit organizations, and that's not the most coordinated or effective way to sort of manage things. In Chittenden County, I told you we have over 800 households that are experiencing homelessness. In Addison County, I think they have like 45. So we need to be able locally to make local decisions, and because we don't have that county level municipal leadership, it makes it really challenging to do that.
So we have, wait, we have Sally online, and then Ridge also wanted to make a comment, but, and you got some other, Sally's been. Go ahead, Sally.
Hi. So, first of all, I appreciate, as I think all of us do, the work that you and your people do for this problem. My question is, do you have any sense of how accurate you are in collecting and identifying the homeless people? Are there homeless out there that you don't know about?
That is a question that links really closely to the data point around people who are unsheltered. And so we collect data both through our coordinated entry system, but also for people who are experiencing unsheltered homelessness. So I feel confident in our data, keeping in mind that people need to meet the HUD definition of homeless, which can be super narrow, and doesn't include things like being like what we would call doubled up, or like if you're sleeping on the floor in somebody's house, then you don't meet the federal definition of homelessness. If you are barely getting by and self-paying in a motel, for example, working just to pay your weekly rate at your motel, you don't meet the definition of homeless. So I think I think for folks who meet that definition, we're doing a very good job of collecting that data. But for folks who don't meet that definition and are still incredibly housing insecure, we don't have a method to be able to track that.
And just one more question, because we're getting out
Yeah,
of time.
Reg,
That'll be last.
go ahead, Reg. You have to unmute yourself.
Can you hear me now?
Yes.
Okay, I just wanted to offer some quick perspective since you were talking about homelessness. And you guys, it sounds like you're doing a fantastic job. If you multiply what you're dealing with by about 50, that's what's going on down here in Atlanta. And I can tell you a couple of quick things because obviously they're not used to anything closely resembling winter down here at all. So when the temperature drops, panic sets in. What they tried to do was they tried to set up what they called warming shelters that people could go to and get warm for periods of time. Unfortunately, they didn't consider the fact that in order to use that, a homeless person has to be able to get to the homing shelter.
Yeah.
And since a lot of them couldn't get there, it didn't do a whole lot of good. That was the first problem. Second problem, and if you want irony, this one will get you. One thing they decided to do, because they want the city to look nice for a whole bunch of events coming in, they decided that they were going to bulldoze and remove all of the homeless encampments in the Atlanta area. And so they sent out these notices to all these people saying, such and such a time, this is not going to exist. We're going to overrun it. You have to go someplace. They didn't tell them where to go, just you have to go someplace. And that's what they did. Unfortunately, in one of them, one person didn't get the memo. And he died.
Understand.
Yeah, I'll just say briefly that we need to recognize that it is not people who have the barriers to accessing our system and our resources, because our system has the barriers to being able to help folks. And so alleviating those barriers, such as transportation, has been critical in our efforts to make sure that we are allowing access to folks to this extreme cold shelter by driving a bus around in the night. Further, I guess I would just close by saying that encampment sweeps are completely against best practice. This happened similarly in New Orleans. And that is not something that that we should be doing at all. We should not be removing folks who are living in encampments unless we have, unless it is unsafe for some reason and there's a public health issue, but unless they have an indoor shelter accommodation to go to.
Well, Sarah, thank you for your being here today and making us here. You had a challenging job and everything. Please know if we can really help you. And Wednesday, Sarah, we got a couple of things here. In your honor, we appreciate you being here. In your honor, a donation will be made to the Connecting Youth Mentoring Program at Williston Central School. We appreciate that. And lastly, you have to pick the winner for our raffle. Drum roll.
Okay, let's see.
Go there and
Okay,
The last
Just
four numbers, last
last
four numbers.
three.
Last one.
395.
I didn't close.
395.
395.
Yay.
Hey, Charlie's back.
Charlie's the winner. Once again, Sarah, thank you so much.
Thank you. Thank you all. I actually have to scoop because I gotta get to that meeting, but I would love, I'm sorry to not stay for.
That's okay.
Yeah.
Thank you so much for being here. We really appreciate
Yeah,
it.
thanks, everybody.
All right, Chris, some inspiration or more inspiration?
I know. I'll just follow. When Elizabeth asked me, if I would give the inspiration today, I enjoy poetry. I think you know that. I have a number of books that I go to for various reasons. I immediately went to, given the political climate and everything else that's happening locally, state, and actually internationally, I picked up the book, The Path to Kindness. It's a collection of connection and joy. And the very first one is called Small Kindnesses. And it really resonated with me. It's quite simple, but I think it will speak to all of you. And so think about the small kindnesses that you're going to do today. I've been thinking about the way when you walk down a crowded aisle, people pull in their legs to let you by. Or how strangers will say, bless you, when somebody sneezes, a leftover, by the way, from the bubonic plague. Don't die, we're saying. And sometimes when you spill lemons from your grocery bag, someone else will help you pick them up. Mostly, we don't want to harm each other. We want to be handed our cup of coffee hot and to say thank you to the person handing it to us. To smile at them and for them to smile back. For the waitress to call us honey when she sets down the bowl of clam chowder, and for the driver in that red pickup truck to let us pass. We have so little of each other now, so far from tribe and fire. Only these brief moments of exchange, when if they are what if they are the true dwelling of the holy? These fleeting temples we make together when we say, here, have my seat. Go ahead, you first. I like your hat.
Thank you, Chris. That was lovely.